Doctors of Reddit, what is your best how the hell did the patient survive story? I'm a nerdoc and went to see a whole patient with a complaint of toe pain. Sat down to really talk with the guy since it was a lull in my shift. Said his toe hurt because he dropped a knife on it. Asked him, were you cooking or what? He looks up from his foot and I notice a thin red line on his neck below his thyroid cartilage Adam's apple. My heart sank, then started pounding. It's really hard to slit your own throat without bleeding to death, but not impossible if you hit the trachea just right and it lines back up when you look down. Which is what this guy had done. He had cut nearly all the way through his trachea windpipe, and just the muscle in the back was preventing it from falling into his chest, causing him to die by suffocation. Once that happened, I wouldn't be able to help him, not with intubation, breathing tube or cricothyroidotomy cutting into neck, since his trachea would be retracted into his chest. Very calmly I called cardiothoracic surgery and got the guy to the OR still looking at his toe to maintain the seal for a tracheal repair. He was discharged to the psych floor 3 days later, since this was a suicide attempt, but did well. I knew he had already decided to live, since we had about a half hour to calmly talk to each other waiting for the OR to be ready. If he wanted to finish himself off, he would have just need to look at the ceiling. Like many patients in the ER, his story was poignant, his acuity wasn't immediately obvious, and there is morbid humor associated with the case. When we tell our trainees about this case we refer to him as the Canadian. I was a resident at the time. It was the end of my shift, and I walked past a guy walking to the front desk with a goddamn harpoon in his head. It came in from below the chin and got out through the top of the skull. Dude wanted to go harpoon fishing. There was an accident in the boat, and he shot himself, so he turned the boat around, sailed to shore, got into his car and drove to the nearest hospital, where he parked, and walked into the reception. He was completely conscious and couldn't speak for obvious reasons, but he wrote down eloquently. I heard he was sent home the very next day with no complications. When my dad was in residency, he was helping deliver babies. One came out stillborn. It was a rough time for everyone. Dad had to carry the baby away, and the entire time he carried the body away he did chest compressions. The baby started to breathe again. Dad had to bring the baby back. By all accounts, the likelihood of that working was extremely low, as they had already done everything they were supposed to for longer than they were supposed to do it. The parents had to go through some trauma therapy after that. That's all I know about that story. Edit, my first ever gold. Thanks stranger. Had a patient who was out having drinks and fishing at night. Well, a wave hit and he stumbled right onto his pole, somehow impaling it through his eye and touching the back of his skull. Amazing that he survived it given the fishing pole-sized crater through his brain on the MRI. I know a gentleman who has both of his carotid arteries completely blocked off. He obviously gets enough blood flow from other vessels to keep going, and I'm sure these other routes have developed over the years, but still. I remember reading the scan results and having to go over them more than once, like 100% blockage. Okay, that's bad. Wait, on the left and the right. Damn.
N.
Our friend blacked out driving home. The last thing he remembers is pulling into the other lane to pass someone. The car flipped twice, and they had to cut him out from the top. He was unresponsive and the EMTs were ready to call him DOA. He broke a vertebrae in his neck and shattered his hand. They were floored when they realized he was still alive. If it had been one vertebrae higher, he would have been paralyzed. As it was, he walked out of the hospital less than a week later. He had been wearing his seatbelt, which is literally the only reason he is alive today. It was my first day rounding with the surgery team, and as we approached a patient's room, one of the surgeons turned to me and said, check this out. This man has had more than 70 abdominal surgeries. We walked into the room and the first thing I noticed was that it was really homey, which is unusual for a hospital. He had some aromatherapy going on, and pictures taped to the wall. A guest cot was set up with several pillows from home, and a nice knit blanket in the corner. It was clear that he had been there a while. The patient was a somewhat overweight, probably obese, man who had indeed had more than 70 abdominal surgeries. Unfortunately, at some point the skin and fatty tissue on his abdomen had become infected and been removed. The result was a square cutout on his belly, from the nipple line to his belly button, extending across his entire stomach. It was perfectly square, with perfectly normal skin and fat around the cutout, and when he breathed, his abdominal muscles and intestines would just sort of come in and out of the abdominal cavity with each breath. He looked like something out of a zombie movie, but was apparently doing alright and living with it. He was attached to a machine called a wound vac that kept the wound clean and provided suction to remove any fluid, or in his case, feces that developed in the wound. We were waiting for the day when he stopped leaking stool into the square to get him a skin graft. We were still waiting when I left the surgery service a month later. A 20-something boy got shot in the head, straight on, mind you. Dude came to the hospital awake and talking. I personally saw the CT scan with the bullet still in his skull. My favorite part was he claimed it was a drive-by shooting. I have never seen anything more centered on someone's forehead. Dead center, no joke. Seems highly unlikely that it was random. A year ago, I was involved with treating a 65-year-old lady walking across the street to get lunch one day. She got hit by a semi-truck doing 45. Broke all the bones on the left side of her body, some of them in multiple places. She also had a moral lavally skin separates off the underlying tissue that involved about 70% of her left leg, from hip to ankle. Had a pelvic fracture that was open into her rectum with a large perineal wound. Took multiple surgeries over several weeks, but at her most recent follow-up accident happened a year ago. She was walking and basically back to normal. Not a doctor, but my father is. In his first rotation of residency, he had to assist in operating on an 8-year-old boy. Poor kid's dad was chopping wood, and he got in the way of the swing. Axe was lodged deep in his skull when he came into the air. According to my dad, the boy survived, but the way he describes the father's devastation at having brutally injured his own son really makes me understand why my dad was always so uptight about things like fire, knives, and of course axes when I was a kid. I had a dog brought in that had eaten a bunch of anticoagulant rat poison about a week prior. They didn't think anything of it at the time, because the dog was fine immediately after. If a dog gets into anticoagulant poison, and you catch it right away, you can decontaminate them, and give vitamin K, and they'll usually be fine. By the time they decided their dog should see the vet, it was dripping blood from every orifice, in shock, and had a packed cell count of 6%. For some reason, they'd let me hospitalize and start vitamin K, but they would not let me transfuse that dog. It was bleeding from its freaking tear ducts, too weak to lift its head, and I was so convinced it was going to bleed out in front of me if I couldn't buy it sometime with some donor blood. That stubborn little pup pulled through and was going strong when I saw her a year later for her regular checkup. My grandma's dad. That dude was in love with this girl, but was hated by her family, so they ran away into the woods. Little did they know, her father ordered his sons to hunt him down and bring back the daughter. So they did, and meanwhile they put a bullet straight to his chest. But that bastard survived the bullet, and later on created a lineage with that one. Also he did many years in Guliotic Yugoslavian version of Gilligan, survived everything. Truly one of a kind. Edit. He had the bullet in his chest till his last breath. Not a medical professional, but I used to hang around with one. They had a young woman brought in one night who had been stabbed 77 times and laid in a ditch for hours before someone saw her and called 911. She made a full recovery. My buddy was so shocked that she was alive and conscious that he called me from work to tell me about it. And then there was a guy who fell off the 3rd rung of a ladder, hit his head just right, and died instantly. Life is weird. Or, in this case, death is weird. One of my parents worked at an ER in a very large city. Most people who come into the ER in an ambulance are not walking in. Until one night shift this guy is walking in, escorted by one of the EMTs who had his hand on this guy's elbow. The EMT looked totally freaked out, due to strolling with a slightly dazed look on his face. My parent wondered what was up, why is this guy walking, and how is this experienced EMT looking so freaked. Then the guy turned his head, and just the hilt of a knife was sticking out. Apparently it was a gang fight. This knife managed to miss every part of his brain that would have killed him. Not a doctor, but my dad survived diabetic ketoacidosis, massive heart attack and kidney failure. Doctors told us to prepare for his death. We called in the priest, brought all the family in. He was on life support for a week and kept on improving. They gradually brought him out of it. When he came to, he ripped out his tubes. The doctor who prepared us for his passing came back from vacation and saw my dad alive and recovering and said, "You are the last person I thought to see again." My dad blinked and asked, "Who is that? He's still alive." In nursing school I had an elderly patient who had a Whipple surgery, very extensive abdominal surgery to resect pancreatic cancer, and must have perforated. It took 3 days of worsening redness before the order came to remove the staples. I was helping out as a stench of blood, pus and poop filled the room. The next month of clinicals included 7 times per day dressing changes, pulling yards and yards of blood and feces soaked packing out of the wound. Somehow this guy actually made it through. I have no idea how he didn't get septic. The story of Mary Vincent is insane. She was a teenager and hitchhiking on the west coast of the US. Got picked up by a madman who raped her repeatedly over the course of a couple hours. Eventually she fought back and grabbed onto his arms. When she wouldn't let go, he chopped her arms off with a hatchet and threw her body into a ravine. For hours she climbed 30 feet up the side of the ravine sans arms and eventually made it to the side of the highway. Naked, muddy, bloody with still bleeding stumps where her arms would be. Apparently she scared the first car off when they pulled over for her, but the second car brought her to the hospital after her 2-day-long nightmare. She's still alive like 20 years later and has 2 kids. She's a freaking badass. Recently coded a patient for 40+ minutes. Everybody wanted to stop, but he was young 50s, so I persisted. People don't come back from codes that long. Then, all of a sudden he gets a pulse back. So we think this is temporary and wonder about an arctic brain injury. I leave service, come back days later, and smack on day 1 discharge him home in stable condition. He had a full-blown conversation and was so thankful, tearful, and kept saying thank you for not giving up on me. He had no deficits. Mind blown. I'm not a doctor, but this is a story of my late grandpa. He was crossing the road one night and got struck by a car. Police said when the car struck him the force literally knocked him out of his shoes, and that from where the shoes were on the road was 60 feet away from where he landed. He landed in the windshield of a car coming the opposite direction. No shoot. He was taken to hospital and was DOA, resuscitated and in a coma with severe brain damage. Doctors told my mum he was never going to wake up, and if he did he wouldn't be able to walk or talk. Whilst in a coma he died and was resuscitated twice more. Eventually, beyond anyone's belief, he woke up, and after weeks in the hospital bed he looked out the window, pointed at the cars on the road and said football. He went on to make a near full recovery, slight slurred speech, and not full movement in the left arm. Went on to live on borrowed time until the age of 80, roughly 30 years after the accident. Miss that guy. Not my story but my sister's. She had an infamous drug addict in her 50s admitted for endocarditis heart infection who had multiple previous admissions in the same hospital. During her stay the patient went through withdrawal and had not 1 or 2, but 3 cases of Torsades D points that needed defibrillation. Where most people don't survive not even one of these arrhythmias, this patient quickly recovered and was asking not a week later to be discharged cause she was ready to party again. My story would have to be a drunk 20-something that came after being stabbed on the forehead. We worked him up in casualty and found a large amount of air that had been sucked in his skull from the open wound. Patient clearly needed neurosurgical intervention, but got impatient and decided to abscond. We searched for patient and tried contacting him, but couldn't find him. Patient returned a week later being brought in by his mother because he kept complaining of headaches. On the trauma service just before Christmas several years ago, get paged for incoming 911 on a trauma at some time near midnight. Walk out of the workroom on the top floor of the hospital and I can see several blocks away the road lit up with cop cars and ambulances. Knew it was going to be bad. 20-ish-year-old comes in after being shot 7 times in the chest, awake, talking. Every single bullet missed every vital organ and he survived. His 16-year-old buddy gets shot just once in the chest and dies on the scene immediately. Cops show me their body cam of the scene with them doing everything they can to save this kid, but he was too far gone. Police later caught the 2 suspects who had been doing home invasions, including another murder, shooting another robbery victim in the street, and knocking over several pharmacies. Wrong place, wrong time. 16-year-old waiting for Christmas and the rest of his life gone in an instant. Life just isn't fair. My grandfather got shot 7 times, caught to shrapnel which they took out from between his intestines only with some chugs of liquor as anesthesia, and survived 5 years sleeping on a concrete floor in a Siberian gulag. Mutherfriker lived until 83, toughest person I knew. Not a doctor. My grandpa though stepped on a landmine which resulted in lost fingers and stitches in his lower arm that were done with toothpicks. Was made to run for miles in the nude as a prisoner of war with these injuries, all while hiding a journal in which he recounted all of these stories. Also was shot in the head and survived with no brain damage. There are other things that I can't remember anymore, but he was tough as nails. When I was 7 or 8 he was in his 80s. He used to outrun me in a race with no issues. A year later, freaking cancer. He went from gardening and carrying bags of soil to his death in 2 weeks. When I was at work someone pointed out this lady walking down the hall. They told me she was shot 7 times in one go and survived. Edit. Some context. I was told the lady was in a stolen car and they opened fire on the police. The police returned fire,